Well, good afternoon, everyone. We're going to be underway in just a couple moments. First off, as we've seen through the slideshow that's been going just prior to the opening, we're using the chat function and the Q&A as our way to communicate. So if you have any questions or comments during the course of the presentation, please use those tools or the raise your hand function, and I'll be monitoring that through the course of the program. And so if there's any kind of questions at all, we'll be able to address those. As always, I'd like to recognize our sponsors, CHS Nutrition, Dakota Land Feeds, and Zoetis Animal Health. Big thanks to those folks for helping out throughout the course of this short course. And if you have the opportunity to interact with any of those folks, please express your appreciation. It's my privilege to introduce Dr. Russ Daly. Dr. Daly is our SDSU Extension veterinarian, and he's going to be talking about feedlot health management, feedlot cattle health strategies. That's the exact title. And I don't have the slides right in front of me. I sometimes get them fouled up. So without further ado, I will turn the stage over to Dr. Daly, and he'll be talking about feedlot cattle health strategies.
Okay, thanks much, Warren. Let me get things pulled up here. And Warren, you can tell me if everything's looking the way it should. Doing okay?
Just start your slideshow. You just need to start the slideshow.
Okay. Maybe I'm sharing the wrong screen. Is that starting yet?
So far, we're seeing with all of the individual slides.
I'm going to try something different here. How is this now?
We're good.
All right. We're going good. Thanks, Warren, for the introduction, and thanks for inviting me to be a part of this today. So my role here during the feedlot short course is to talk about health and disease considerations during the feedlot period. As Warren mentioned, I'm Dr. Russ Daly, Extension Veterinarian at SDSU. And the talk today it's a really broad topic, right? I mean, feedlot health, it could amount to about anything. And so we can really dive into a lot of details if we want to, but here's what we're gonna take today. The tactics we're gonna take today is just to give a big overview of these disease issues. And for each one of these disease issues, I'm really going to focus on the risk factors. What are the underlying factors that make these problems in cattle, in groups of cattle? We're going to spend a lot of time on nutritional management. That's been a good focus of this feedlot short course so far, and we're going to get into some of the other parts of this short course that would be really helpful in eliminating some of the problems that I'm going to be talking about today. Role of medications, role of vaccines. I'm going to give you a spoiler alert. We're not going to spend a lot of time on those because as we're going to see, so many of these issues really have some nutritional components to them. Even ones you might not expect would be nutritionally related. And then the bottom line we'll summarize and end up with some questions at the end. So here's the things we're going to talk about today. The major issues that we face with feedlot animals today. There are others that we could be talking about too. And there are others that are emerging in importance. Some of the heart failure issues in feedlots are taking a bigger role, especially in some parts of the country. Not going to cover that specifically. More of these things are going to be things that are related to infectious disease or germs or most of these anyway. So that's the list that we're going to hit on. And again, it's a lot to cover in 45 minutes to 50 minutes. So it's going to be an overview, but it's going to hopefully give you some food for thought on ways that you can control these issues in feedlots if you are seeing some of these issues. Now, what we find is that when we have the big wrecks, when we have big herd outbreaks where multiple animals are affected at once, yeah, it tends to be in the early feeding periods. But we can certainly have problems later on in the feeding period. Those tend to be more individual animal problems where we'll see not maybe as many animals at once affected. And this is a pretty general comment. You can certainly see exceptions to this. And that's not to say that problems that happen later in the feeding period are better, because we can have these individual animal things mount up. And that's exactly what we see in many of these cases that we're going to be talking about. So I want to start out with a big one, bovine respiratory disease complex. It's the one that we've known about for years and years, and frankly, we haven't really gotten much of a better angle on preventing this. And there's a lot of different reasons for that. Some of them are due to the bugs, some of them are due to the animals, and some are just due to economics and the fact that sometimes we take chances on animals that are a little less expensive, but maybe more risky and more at risk for respiratory disease. But bovine BRDC is the number one disease of fed cattle. It's caused by bacteria at its core. When we see animals sick with pneumonia, we're going to be dealing with bacterial infections such as Mannheimia hemolytica, Pasteurella multocida, Haemophilus somni. Those are the big ones. Now, that's not to say that viruses can't be involved here too, but most of the time what we see is the viruses play a role in getting these bacterial infections started. The other thing that's interesting about bovine respiratory disease complex is these bacteria, these nasty germs, they're usually found in normal animals. We can go into any given group of animals in a feedlot. If we culture enough animals in the nasal passages in the back of the throat, we're going to find these nasty bugs. They don't cause any problems up in the nasal passages in the back of the throat. Once they make their way down to the lungs, that's when we have this cascade of inflammation. The lungs are physiologically set up to be really affected by inflammation. And so any insult that gets down at the alveolar level, so the air exchange level, is going to be really profound compared to inflammation in other parts of the body. And we can see a whole continuum of respiratory disease complex in a group of animals or between groups of animals over time. So we can have anything that happens, very acutely, come on very quickly, and very severe and profound issues, to more of a chronic and subclinical type of problem that we might not even, that might not even really register with us as being an issue. So with respiratory disease complex, we know the risk factors, right? We know that stressful conditions such as long transport, commingling, prolonged events such as that will raise cortisol levels in the bloodstream. It usually takes prolonged stresses. The short-term stresses, like a short-term weather event is not going to be as profoundly affecting bovine respiratory disease as these longer term issues. Cortisol has an immunosuppressive function and allows those bacteria that are in the nasal passages to get down in the lungs. I mentioned viral infections, things like IBR and BRSV. Sometimes they can cause problems by themselves. Not very often, though. More of the time, we're seeing these viruses damage the lining of the trachea, for example, and make the bacteria, make it easier for the bacteria to get down into the depths of the lungs where that inflammation and pneumonia occurs. Cold air helps the colonization of bacteria in the nasal passages, and more bacteria there means more of a chance that they're going to get down into the lungs. Dehydration messes up that clearance mechanism for the animals to get rid of those bacteria that are making their way down into the lungs. Vitamin deficiencies can play a role in the immune system especially, and then acidosis. Acidosis A low blood pH in the animal has a direct effect on the pulmonary macrophages that live down in the depths of the lungs and kind of are that last line of defense for these bacteria, of these bacteria to get down and cause damage in the lungs. So acidosis plays a role here in causing pneumonia as well. Next one I wanted to mention is atypical interstitial pneumonia. This is another kind of pneumonia, but it's not directly associated, from what we know, it's not directly associated with a germ. This is something, and what you see here on this picture is the cut surface of a lung, and you can see that that there's a lot of air and fluid in these divisions between the lobules of the lungs. That makes it very hard for that air exchange to take place. And so what we find is a lung that's filled up with fluid. We find a lung that's emphysetic. In other words, there's air in the parts of the lung where it shouldn't be. And that makes it for a very dramatic clinical signs. We'll see animals that are really panting and puffing and laboring to get air. So this is more of a sporadic thing. It's due to an injury at the lower alveolar cell level, down in the depths of the lungs. We have long known that AIP, or atypical interstitial pneumonia, can be brought on by a metabolite called 3-methylindole. And this is a byproduct of the metabolism in the calf's body of green forage. So I've seen it in practice where, you know, we'll have in the fall or in the springtime of the year, we'll have a patch of grass that's really growing lushly and quickly, and we'll move animals out onto that pasture, and we will see these kind of things happen right away, this atypical interstitial pneumonia. Now that doesn't really apply to the feedlot, right? There's a lot of controversy about what are the risk factors for atypical interstitial pneumonia in feedlot cattle. We see this, I would say probably it's being increasingly identified in feedlot cattle over time. We're still dealing with things like these metabolites, even in feedlot rations, right? So anything that kind of messes up that equilibrium that the rumen bacteria have with processing these byproducts of feed can bring this on, we think. So feed disruptions of delivery or formulation, in other words, changes in the schedule of feeding, changing in ration formulation, can cause these byproducts of metabolism to potentially build up, and once they're in the bloodstream and find their way to the lungs, they can damage the alveolar cells. There's been some thought too about BRSV as being a predisposing factor. So BRSV stands for bovine respiratory syncytial virus. There's been some talk that this kind of sets up the lungs for atypical interstitial pneumonia. But not always. You know, we don't always find BRSV to be a component of these. And I didn't put some other things on here. There's a pretty long list. If you talk to feedlot veterinarians and list all the different ideas for what causes this, you'll get a pretty long list. And anytime you have a pretty long list, that means that it's probably one of two things. We don't know what it is, or probably more likely, there's a lot of different factors that could be at play, and it could be a different set of factors for a different set of cattle. So, you know, I've heard talk of ethyl carbamate in distillers grains fed to feedlot animals as being a potential cause of this too, but again, we know that this happens in lots of animals where distillers isn't fed as well. So we don't have, it's a very frustrating issue. It's hard to treat these animals. You pretty much have to use diuretics to bring the fluid out of the lungs, and maybe some dexamethasone, some steroids to kind of help them, help that inflammation go down. But these are really tough cases to treat, and they're very dramatic, and these animals can die pretty rapidly. So it's something we need to stay tuned for. And if you have this problem, again, it's usually later in the feeding period. It's something that can be pretty frustrating to manage around. Mycoplasma bovis. Okay, this is another bacteria, but it's a really weird bacteria. It's one of the smaller cells that we know of. It's even smaller than viruses. It's a bacteria that can get into the lungs, is probably where most of these infections start. They'll be breathed into the lungs, just like the other bacteria that cause the respiratory disease. They'll set up shop in the nasal passages in the back of the throat. Once it gets down into the lungs, that's where it can cause pneumonia, but it can also get into the bloodstream and go to other places as well. So it can get into the joints in the legs. It can get into the inner ear and cause a head tilt. What we think is, like I say, usually begins in the lungs and moves elsewhere into the bloodstream. This is a really slow growing bug. It's almost impossible to culture it in the diagnostic lab. So we usually use PCR to determine that it's present in the animal, or in the tissues, I should say. So it's really cell related. It's very tough to get antibiotics to the site where the animal's infected. So it can be very difficult to treat. There are some antibiotics that are effective in the lab against mycoplasma, but by the time you try to get them into the joints, into the inner ear, for example, it's just pretty tough. And oftentimes we end up with just kind of chronically affected animals in the feedlot. Some of the risk factors for mycoplasma very similar to what we would see with BRSV, because the pathogenesis is very, very similar. In fact, the list I've got there is essentially the same as the risk factors for bovine respiratory disease. So even if you do have joint problems with mycoplasma, if you do have inner ear problems with mycoplasma, it's probably starting in the lungs. The risk factors that affect bacteria getting down into the lungs are the ones we need to pay attention to. Here's one that in recent years is becoming more recognized, I think, Histophilus somni. Now, I mentioned Histophilus as a potential cause of pneumonia in the cattle in BRD cases, and that's definitely the case. But we also know that this same bug, probably different strains of it or different versions of it than the pneumonia one, are ones that can cause problems in the heart. So we actually have an infection in the heart muscle. It's hard to see on this slide, but the arrows kind of denote it. There's a dark area in this papillary muscle in the heart. This is a cross section of the heart, like you cut through the right ventricle and the left ventricle, and we've got an infection in the heart, in the muscle actually. And when that happens, we have a sudden death. We have heart failure, and that can be something that you don't even see any clinical signs. The animal just basically kind of tips over. This is also a germ that can infect the central nervous system. So we can have brain infections causing what we call the brainer, CNS signs of disorientation when they're down on their side paddling. Histophilus somni can be an issue there as well. But just like mycoplasma, we think that even the heart infections, even the brain infections, probably begin in the lungs, and then those bacteria enter the bloodstream to go to the other parts of the body. So that's how the bacteria gets its access to the body, is getting through the lungs and then entering the bloodstream there. This germ is really good at infecting small blood vessels, leading to clots and formation of dead areas. So that's kind of how it affects the brain and the heart when it infects those parts of the body. Here's that same list of risk factors. Okay, so the bacteria is making its way from the nasal passages down into the lungs. All of these things are at play for risk factors for Histophilus. Now, another brain issue is polio, and many of you have probably seen this pop up in your feedlot animals as well. This is damage to the gray matter in the brain. And this will result in those brainer signs that I talked about, where the animal's initially very disoriented and kind of incoordinated, maybe just seems a little off. That's the first thing you notice, to the point where they're just having a hard time getting up and getting around. And then the paddling on their side is kind of the terminal event with polio. This at its root is a thiamine deficiency. Okay, so thiamine, one of the B vitamins, is necessary for the normal metabolism of that part of the brain, especially. So at its root, it's something that messes up the thiamine metabolism in the body. Now, how does that happen? Well, that's another case where when normal rumen function is disrupted, say with an acidosis situation, and we change the population of the rumen microbes, then we can have an issue with thiamine not being produced in enough in enough amount to maintain that brain function. We also know that sulfur toxicity can be an issue here and disrupt that thiamine metabolism as well. This is an issue, it had been historically an issue with certain loads of distiller's grain, for example. But we do know that in certain water situations, high sulfur can be a problem as well. They have high sulfur, marginally high sulfur in the water and marginally high sulfur in the feed can combine to create a toxicity problem that disrupts the thiamine that causes the polio. Now, if you get to these animals quickly enough, and I've had success with this in practice, you get to them quick enough if you IV them with thiamine. We also usually give them some anti-inflammatories and some other antibiotics to kind of cover us for the Histophilus cause of the brainers. A lot of times, if we get them quick enough where they haven't been down that long, we can sometimes bring them out of it. The risk factors for I don't know. Okay, now I think I'm right. I think I'm right here now. With polio, risk factors for polio would be the poor adaptation to the high concentrate diets. Like I mentioned, disrupting that normal rumen bug function, and high sulfur feed and water sources. Bloats, we do get into problems in the feedlot. Usually we're going to see these as individual animal situations. When we see them in any numbers, that usually indicates a pretty good mess up with something with feed formulation. Couple types of bloats. One is the free gas bloat, right? When there's just a big a bubble of gas, free gas on in the rumen, on the top of the rumen, that's just not being able to be burped out, basically. When we have free gas bloat, that can be an issue with rumen motility. The rumen isn't contracting like it should be. That can be an issue when we see acidosis. Acidosis kind of has a paralyzing effect on the rumen, and we're not going to have the normal contractions taking place. More common, unfortunately, is the frothy bloat. And this is the situation, you've probably seen this at the end of a bloat tube when you're trying to relieve these, is it's more of a foam, a very stable foam. These are, we think frothy bloat is caused by byproducts of rumen bacteria that are dying off in the rumen. And they have enough mucin or other kind of different cell wall components that stabilize that foam. So we've got a situation there where we got a lot of gas building up in that animal, but we don't have a way for it to coalesce into one big bubble that they can actually burp off. So risk factors for bloat: acidosis, like I mentioned, with the free gas bloat. Finely ground feed will help perpetuate frothy bloat issues. And we do see frothy bloat with more commonly with high quality alfalfa, and it has to do with the types of substances in the cell walls of that feed. Another sudden death kind of thing that we see is Clostridial enterotoxemia. This is caused by a bacteria called Clostridium perfringens. And there's some discussion and controversy about this within feedlot veterinarians as well, is what type of Clostridium causes enterotoxemia like this. So in my training, in my thoughts, type D is something that would be associated with many of these cases. The trouble with diagnostics, and this is that last bullet point here, is difficult to confirm Clostridial enterotoxemia as a cause of death. First of all, because if we just looked for Clostridium perfringens in the body and the gut, we'd find it. It's a component of normal animals. It rapidly proliferates after death, for example. So just finding the bug isn't enough to tell us that that's what caused the problem. So a lot of times when we post these animals, we're just kind of ruling out other things. But what the pathogenesis of this is that when these Clostridium perfringens proliferate in the gut or grow abnormally, when the conditions are just right in the gut for them to take off and grow, they produce a toxin. And this toxin causes brain swelling and multiple organ failures. And we will see a rapid death. So the typical thing here, you won't see clinical signs of these animals. You just go out in the morning and find, this lovely thing waiting for you as you feed the animals. You just find something tipped over in the lot. Now, the risk factor for Clostridium is more also with the adaptation to high concentrate diets. And the reason for that is this proliferation in the gut. And you'll actually see the same thing with Clostridium perfringens type A, possibly in baby calves. So these Clostridium are everywhere. The animals are exposed to them in their environment, in other cattle's manure, in their own manure, and they usually don't cause any problem. But when the conditions are just right, and that's usually in the first part of the small intestine, for them to grow, when there's high carbohydrates, high protein. So when we're kind of pushing the envelope as far as high concentrate diets, that a little bit more of those carbohydrates spill over into the small intestine, making it a very perfect environment for those Clostridium to proliferate and grow and then produce the toxin. So that's why I say the risk factor here has to do more with high concentrate diets, really, than any, quote unquote infection. Another common condition that we find in the feedlot is coccidiosis. This is caused by a germ, protozoal germ, intestinal problem. This results in usually a diarrhea with or without blood. So we can, there we go. We don't necessarily have to see blood. The blood in coccidiosis in the diarrhea indicates we've got some pretty good damage to the wall of the intestine. Now we can see cocci in any age cattle, anything above 4 weeks of age actually. So we can see it in the feedlot. We do see it in the feedlot. I've seen it in adult animals once in a while when they're stressed for some reason. But when we see it in the feedlot, it's usually associated with wet, cool conditions, some of the animals shedding more of it into the environment, and then other animals picking it up. Very easily diagnosed with a fecal sample that any veterinarian can do in their clinic. Once in a while, we'll run into situations where the diarrhea precedes the shedding of the oocyst or the shedding of the little eggs in the manure. So sometimes we can have the problem where the eggs aren't there in the manure, but that's a pretty rare situation. So that's something we see. Stress with weather, cool, wet environmental conditions, stress through transport and commingling are when we're going to see, are the risk factors for coccidiosis. And again, so we would expect to see this to be something early on in the feeding period for the most part. So what this slide does is put all of those different risk factors that I put up for each individual disease all into one slide. So, I talked a lot about stress. We talked about viral infections, especially when it comes to respiratory disease and mycoplasma and Histophilus, cold air, dehydration, all these different things that we know are not good. But I also want to have you think about how many things on this list actually have to do with nutrition, right? So we're very eager to point our fingers at a bug, a germ, a lack of a vaccination program, for example, as our problem. Whereas, so many of these issues that I talked about have nutrition, have a nutritional component. And so that's what this slide does here. So to take it from the other side, what are the things that acidosis can contribute to? I talked about acidosis being something that inhibits the pulmonary macrophages, those white blood cells in the lungs. So an acidosis situation where our feed formulation hasn't been just right, when we have overload situations, that's when we can have an onset in pneumonia. That's when we can have an onset of sudden death of Histophilus, heart failure. That's when we get the mycoplasma, and then we can have that bloat situation from the rumen not being able to contract. So kind of associated with that is the poor adaptation to high concentrate diets. So, as we bump animals up through the feeding period, if we don't pay attention to, making good decisions about when to increase the amount of concentrate in the diet, for example, that's when we see it's that interface, it's that changing situation. That's when we'll see the polios. That's when we'll see the frothy bloat. That's when we'll see Clostridial enterotoxemia. And I mentioned feed disruptions due to mistakes in ration formulation or delays of feeding on a routine schedule. So that's when we can get the AIP, the polio, bloat, and the enterotoxemia as well. High concentrate diets, high sulfur diets. So all of these issues, even some of these that we would think, it's just a germ, we just got to vaccinate better. We have nutritional components that are definitely something to consider here. Now, I am going to talk a little bit about pharmacology when it's useful. Now, definitely when we see pneumonia issues due to bovine respiratory disease complex, antibiotics are the hallmark of treatment, right? So when we see sick animals, injecting them with individual doses of something like Draxxin or whatever antibiotic you want are going to be is going to be the way to go. Now, as with many things, when we treat animals, the earlier on in the process we can get to them, the better. By the time things have gone chronic and scar tissue started to form in the lungs, these drugs are less effective. And so I don't, not spending a lot of time on pharmacology here and what antibiotics are best. I think there's, we've never had a better probably stable of good antibiotics for use in bovine respiratory disease out there. When they fail, it's usually not the drug. It's usually not a resistant bacteria. It's usually either that process has gone on too long in the animal for antibiotics to really affect anymore, or it's something different. It's not pneumonia, right? I mean, we tend to think of most of our sick feedlot animals as pneumonia first, and then consider other things later. But there's a lot of other things, as I mentioned, that can be causing some of these signs in these animals as well. Coccidiosis is definitely something that we have good treatments and prevention for. I back up to BRD. Yeah, we do have antibiotics that we can use for control and prevention. The metaphylaxis concept of injecting animals with full doses of antibiotics as they get off the truck, high-risk animals, is something that is definitely on the label and something that we can do for prevention. Probably, when we do metaphylaxis like that, we're probably doing all of these things at once: treatment and control, treating some, controlling it in others, and preventing it in others. And in some cases, we do still have the ability to use feed-grade antibiotics for these things too. Coccidiosis, Decox, Corid for treatment, and then our Bovatec and Rumensin for prevention. It should be parts of feedlot rations. When these things aren't useful, I mentioned mycoplasma infections. Yeah, we probably would try Draxxin or some of the other more high test antibiotics, but realize that it's very by the time we notice that in the animal, it's probably very very tough to get the antibiotic to do any good there. Histophilus infections other than the pneumonia, so I'm talking about the heart failure issues, and I'm talking about the Brainer issues, hard to get good antibiotics to where we need to go there. And then Clostridial enterotoxemia, it's a bacteria. You think if we treat the animal, we could get the bacteria to go down and then the toxins to not be produced as well. Well, the trouble with that is that disease just hits so quickly, it's just hard to treat in a timely enough manner to do any good. Once the toxin has been produced by that bacteria, there's no antibiotic that really influences the toxin. You can't kill the toxin, so that's part of the trouble there. So vaccines. I'm going to talk a little bit about the role of vaccines. So definitely, we have good vaccines for the viruses, right? For BRSV, IBR, BVD, we got some pretty good products out there. Where we don't have as good of products for prevention are for the bacterial issues. So Mannheimia, Histophilus, Pasteurella. Now they're out there, sure, but you got to think about how those bacteria, the reason they're problems is because they've learned how to adapt to the animal's body so well. So they've learned how to hang out in the nasal passages and in the back of the throat. So as such, it's hard for us to give an animal a shot that stimulates the body to recognize that bug immunologically, right? It's just the body's so used to kind of hanging out with it that the vaccines don't work all that great. Contrast that with the viruses where, really IBR shouldn't be there in the animal. BRSV shouldn't be there. So they're different enough that we can stimulate a pretty good response in that animal. So then the other issue is go back to my risk factors for respiratory disease. And you'll see that, it is the bacteria that really cause the problems, right? It's the Mannheimia getting down into the depths of the lungs. Not very often is it going to be the IBR. The IBR or BRSV can have a role in setting these germs up, but they're just one of all those risk factors that can help perpetuate or get VRDC going in a group of animals, in addition to stress and weather and those kind of things. So we have them there. You know, another presentation could be actually looking at the current kind of thoughts about vaccinating feedlot calves on arrival. There's a lot of different kind of thoughts out there. There's a lot of different research out there. What I'm getting out of this more and more goes back to the fact that vaccinating a stressed animal that's not on a good plane of increasing nutrition is just hard to get the vaccine to work anyway. So when you see feedlots that do delayed vaccination, that's kind of the goal there is, you know, you vaccinate an animal off the trailer, off the, you know, just out of the sale barn. You know, the vaccine's probably not going to work as well because of all the cortisol in the animal system due to the stress. And we're kind of behind the 8 ball anyway. You know, those animals are already kind of probably incubating some bacteria down in the lungs by the time they even get to your place. So that's another reason why vaccines on arrival right away can, you know, we don't always see the effect we want. And I was guilty of this in practice. You know, we'd take potloads of calves that were bought out west that get off the interstate at our clinic, and we'd you know, bring them into the clinic and get them vaccinated up and put them right on the trailer and drive the last 30 miles to the farmer's feedlot. I don't know if we're really doing those animals much good, because they're definitely under the influence of stress while we're vaccinating. So delayed vaccination, and really what it comes down to is, you know, those animals really have to be set up before they even enter the chain of commerce to the feedlot. If you're feeding your own animals, you have some control over that, right? If you're purchasing them from somewhere else, you don't always. Now, Histophilus somni, because that's a bacteria, when it causes the brain problems, when it causes the heart problems, that's leaving the lungs and it's getting out into the bloodstream. The vaccines have a chance of working on that. You know, so killed vaccines that we have for Histophilus can produce antibodies which can kind of neutralize some of those bacteria that are floating around in the bloodstream. What they don't do a great job of is preventing the Histophilus pneumonia, right? So that's something that is disappointing for people who vaccinate these cattle for Histophilus, and we don't see the result maybe with prevention of pneumonia. But we are probably doing something to diminish the brainer issues and the heart issues to vaccinating animals early and boostering them. It's a killed vaccine that we have available for Histophilus. And then, you know, Clostridial 7 ways are pretty much staples of our vaccine programs for cattle. Probably, you know, it's not a bad idea to booster them, booster those animals coming in, or, you know, at some point in your program with feedlot animals, just because of the enterotoxemia, because of the other things, you know, that we can see occasionally pop up, malignant edema and weird things like that in the feedlot. But understand also that I've seen that Clostridial enterotoxemia, the type D enterotoxemia, tip over calves that have been pretty well recently vaccinated. You know, Clostridial 7 ways work pretty good, but we still, with that enterotoxemia issue, we're not always getting the effect that we'd like. So the bottom line is, I'm going to come back to nutritional management, you know, because we can't always depend on a good vaccine for these issues. Some of the things I talked about, there's no prayer having a vaccine. We don't have a vaccine against bloat, right? Or AIP. So we really, I think the operations that have the most success dealing with these kind of issues are ones that do pay attention to that feeding management component. So hopefully you've gotten out of this that moving to higher concentrate rations carefully and gradually with both the formulations and the amounts can be really key in not only just keeping those animals going on a good rate of gain and feed efficiency. It has to do with health as well. And there's an excellent presentation in this series that Warren did on bunk management, and the fact that it can be kind of tough, when we have weather issues and things, it can be kind of tough to manage those things. But paying attention to that is not only going to pay off in performance, it's going to pay off in health as well. Same way with consistent feed delivery schedules and preventing acidosis. To me, all those things kind of go together. Using Monensin, and that's just going to these goals for polio and avoiding high sulfur in the diets. And when it comes down to, there are so many problems that we can have with the health of feedlot animals. There are some things we can control. There are some things we can't control. The weather issues, other things like that, other things that are in the environment. Those are things we have to manage around. But those things that we can control, especially with the feed-related management, I think hopefully I've gotten across to you that those things are going to pay off in better health and hopefully fewer outbreaks and fewer wrecks with health issues. So that is what I have, Warren. I'd be happy to try to answer any questions that you might have. And hopefully that's stimulated a little bit of thought for you.
So we're looking at the chat and the Q&A, and so far we don't have any questions. So I'll start throwing a few out and see what develops. You talked a bit about that delaying vaccinations after arrival. Any kind of guidance or rules of thumb you might say for timing of that? And is it does the risk level or the perception of health status on the calves that are coming in influence that interval?
Yeah, that's a really good point, a really good question. The research, when you see people do research on this, they're usually talking about delaying it quite a while. And we're not talking about hours, we're talking about like a couple weeks. And the reason for that is to make sure that those animals are acclimated, the stress level has gone down, that they can actually respond to a vaccine. Now, part of the reason why I would take those calves off the pot and get a vaccine into them before they even get to the guy's place is because I always thought we were behind the eight ball. We got to get these vaccines into these animals as quickly as possible, because if we don't, the bugs are going to win the race, right? Well, in actuality, what we find is that those animals are already harboring those germs, and if we really look closely at some of them, we probably find that there's some illness occurring already, some fevers and whatnot. So really, when we have that break in feedlot animals, say a few days to a week after we get the animals in, it's a pretty good indication that they were incubating disease before they even got to our place, and no vaccine is going to work that fast. So so back to my scenario with me vaccinating those animals as quickly as possible. Does it make me nervous, to not do something? Don't you got to give them a shot right off the truck? Yeah, makes me nervous, but as we've learned more about the role of cortisol and stress in these animals, and have had feed yards actually adopt some of these things, we start to understand that if those animals get sick when we didn't vaccinate them off the trailer, they would have probably gotten sick, or even maybe worse, if we would have vaccinated them right as they arrived. So to sum that up, most of the research when people are looking at this are talking about waiting a good 14 days, 10 to 14 days before vaccinating those animals. And really, when you think about what you're really doing there is vaccinating for later on in the feeding period. So the weird BRD outbreaks that would occur later on, or the Histophilus heart issues that might occur later on. So it really gets back to how that calf was treated before they make it to the feedlot. What kind of preconditioning, what kind of shots do they have on the mother, and what kind of boosters do they have right around the time of weaning. That's what it really comes down to.
Dr. Daly had one question in the chat box about how, or in the Q&A section, how does that recommendation change if we're dealing with, say, yearlings or background cattle that are 800 pounds and heavier?
Yeah, with them, the risk of that BRD especially is pretty is less, right? So in some ways that makes vaccination on arrival even less of a less of an issue, or less important even. On the other hand, you're dealing with an animal that can probably handle that stress a little better. So they probably would be the type of animal, if there's any kind of animal that's going to handle a vaccine relatively quickly after arrival, it's going to be something like that. So in those cases, it kind of, in all of this, right, depends on labor. And when the kids are home from school, that's the day you're vaccinating, whether it's the day after they get there, or 21 days after they get there sometimes. So that's a big issue. But that kind of an animal probably is going to be less affected by stress, and more able to respond to a vaccine in general, but also more likely to have been set up very well in the past too. So a lot of different, I guess, permutations to that question there.
So, and this was something you and I discussed just a little bit this morning as we're getting ready. So you know where I'm going with this question. It seems like we've gotten improved vaccines, improved antibiotics, but yet if you look at the industry as a whole, our mortality and morbidity rates seem to be creeping up just a little bit. And so, I'd welcome what your thoughts are on how that, some explanation in your mind anyway, what might be causing our death losses to go from, say, 1% now up to 2 to 2.5, depending on the yard and the class of cattle. Welcome your thoughts on what might be happening there.
Yeah, that's a really good question, and something veterinarians are just kind of struggling with now. I mean, as technology advances and our knowledge advances, you'd think we'd be getting better. There's definitely a lot of factors here. The ability for people to buy high risk animals very affordably, that's not helping that number, I don't think. I would say probably also that we may be seeing kind of a shift in the things that cause that mortality too. My impression is that, early on in my practice career, you'd see a bunch of shipping fever wrecks. You'd see those problems right away, and we're not seeing as much of that. So maybe we're dealing with issues that have more to do with the feeding management, as we try to push animals a little faster, a little more speedily, I guess. Are the nutritional factors kind of entering into play there too? It seems like I've heard feedlot veterinarians at different meetings address that topic much more profoundly than I did there. But I'd say that there's probably not a good consensus on what actually is causing the problem. But I think it could be very, very much a thing where it's very different, as you mentioned, between classes of cattle, between different yards, between seasons of the year as well too.
And we're also feeding them longer, which gives them more opportunities to die sometimes
Yeah,
as well.
right.
So do you have another question in the Q&A box? What are your thoughts on metaphylaxis of high-risk calves on arrival? And how does stress influence how effective that practice might be?
You know, I on a philosophic level, I'm kind of conflicted about metaphylaxis, but on a practical level, I'm a fan. It works when you have high risk cattle. The data will back that up very, very consistently. Is if you have a bunch of high risk cattle and you perform metaphylaxis, which means, for those of you who don't familiar with it, it giving a full dose of either Draxxin or Micatil or Zactran or something, whatever antibiotic to those animals coming off the trailer. So you can expect to cut your death loss and your morbidity in half, when you do that, compared to if you didn't do that in these high risk cattle. That percentage kind of plays out for other groups of cattle as well. So when you got those, you mentioned the backgrounded yearling type of animals, that are in good shape coming into a lot, doesn't pay to do it with them because they're gonna be healthier anyway. But in that high risk group of cattle, it does really work. And I guess the beauty of metaphylaxis compared to trying to vaccinate an animal is the stress really doesn't enter into it. In fact, by providing that antibiotic, it's kind of a buffer against the stress because the stress is kind of helping the bacteria bloom in the animal, and we're giving them an antibiotic to decrease that bloom, so to speak. Whereas it's kind of the opposite with vaccines. The vaccine wouldn't work in that kind of situation because we're depending on the animal's immune system to respond. Whereas all we're really depending on the animal with metaphylaxis is for the drug to get into the bloodstream and get into the lungs, where it's gonna do its work. So the data is pretty clear on high risk animals. It works. Now, defining what a high risk animal is, we can debate that. I think in last year's or the last feedlot short course, we actually got into that a little bit, is how do you characterize animals for high risk and low risk? And there's a lot of different ways to kind of go about that. My philosophic problem with it, and I talk with students about this quite a bit too, is okay, we got it works for high risk cattle. Why do we have high risk cattle? Why don't we just take care of the factors, the shipment, the commingling, the lightweight animals, all that, the bringing animals right off the ranch. Why don't we deal with that as an industry so we don't have to give metaphylaxis? It hasn't gotten to the point yet where consumers are starting to look at this yet. But that you can imagine that would be something that they would be interested in. The other thing we know about metaphylaxis is when you apply antibiotics to a population of animals, they're coming in with those bugs. We're going to make more of those bugs resistant to that same drug you use for metaphylaxis. Now, most of the time that's pretty temporary. That susceptibility to the antibiotic comes back. But most of the stuff that I've seen would indicate that if you use drug A for metaphylaxis and you do happen to get some sick ones come 7 to 10 days later, you better use drug B to treat them with, because there's a pretty good chance if you treat them with the same drug A, those bugs would be resistant, would be a higher chance of it. So that's kind of a mini lecture on metaphylaxis, I guess.
Well, thank you, Dr. Daly. We are just about out of time, so unless I see something that pops up in the Q&A really quickly, we'll wrap things up here. Next week is our final segment for the Feedlot Short Course. And this one, the agenda is really up to you folks as viewers. And we do have one more, sorry, in the Q&A. Individual's been vaccinating 800 pounders on arrival, and 10 to 14 days later sees fevers of 106 average. Is that a result of vaccination or the stress of arrival, or is there something else, perhaps something else going on?
Might depend on the vaccine. We can see that with some modified lives possibly. And yeah, I'd say it probably is a situation where the vaccine is causing some issues. They aren't maybe responding to it as well as they would if we just didn't do anything. It's a little hard to tell with that timing, so it could be just the incubation period of whatever they were harboring coming in. But the vaccine in that case, vaccinating on arrivals, I guess what I'd say in that situation is probably not helping anything. I'd say it'd be about as good an answer that I can give.
Might be a case for that individual before we get into the fall run, could have a conversation with their herd veterinarian and see if there's some things that they could tweak in order to improve outcomes.
Yeah.
All right. Well, I think we are about out of time. As I was just starting to mention, next week is our final segment, and the agenda is really up to you folks. We are putting this together as an open forum. Dr. Daly will be joining us, as well as Dr. Dearson, Dr. Zach Smith, and Dr. Alfredo DiConstanzo. I'll be monitoring or moderating, and we've already had a few really good questions emailed to me. So if you've got something that we haven't addressed, I know we've had a request to talk about feet and lameness problems in the feedlot, and we're going to save that one for next week, but we'll make sure we adjust that as well. Got one quick question before we close it. Intranasal on arrival, then 2 weeks later, the full vaccine program. Dr. Daly, your thoughts?
Well, intranasal vaccines are probably less subject to stress affecting them, but we're still under the same situation. The animal still has to respond to that in some form immunologically. If you use anything on arrival, I would use an intranasal, but understand that the response to that intranasal is still going to be limited compared to if we waited.
Well, I'd like to thank everybody. Looks like we had perhaps some really good possibilities for further discussion next week. Again, we'll be sending out another email requesting questions, but look forward to having all of you folks, or as many as can, join us next week for our last session. Thank you. Have a great rest of the week. Thank you, Dr. Daly, for sharing your expertise with us. And we'll look forward to doing this again one more time next Thursday.